All right, 5:30. Let's get going. Y'all know I'm very serious about being on time. I do my best. Welcome to the Full Circle Women's Care Practice and Pregnancy Orientation. I'm your host, Dr. Adams. I'll be sharing my screen right now. So let me know if you are or when you are able to see my screen. Fantastic. All right, so hold on. This is our orientation webinar, and we have a couple housekeeping items first. Um, First, this is confidential, so feel free to ask questions along the way. I'm probably going to get to a lot of the questions that you already have. So if you have them in front of you, just hang on to them. If I'm talking about a subject and you hear something that relates to what your question is, you can go ahead and pipe up. But I'm probably going to get to most of your answers, and no one's going to know that it's you asking questions. I won't say your name. So feel free to participate. And then if you have to hop off at any point, I know like it's around dinner time, the presentation will be available on our YouTube channel afterward until the end of your pregnancy. So today we're going to go over the full circle experience, which includes where we deliver. We're going to talk about office protocols, what to expect at your pregnancy visits, and how the practice is set up. I'm going to give you a ton of prenatal resources, which again, remember, will be available for the duration of your pregnancy out here on this presentation. We're going to go in depth today about exercise and nutrition in pregnancy, and then we're going to end with an upper respiratory virus update, not specific to COVID-19 only. But let me start with the fact that we are a collaborative midwifery model practice, which means that we believe that pregnancy and birth are normal life processes. The actual physiologic part of going into labor, contractions, having a baby, that's normal. Pregnancy, however, can have some complications that happen with it. You can turn left a little bit. In the traditional midwifery model, it's designed to care for normal pregnancies, low risk women, but if they identify certain abnormalities in the pregnancies, you have to transfer out. You're not able to deliver with midwives anymore. In the collaborative model, you can stay in the care of midwives for your labor and your delivery, but your prenatal care, the medical part where we're figuring out your blood work and your ultrasounds and whether you have any other diagnoses, those are carried out here in the office in a place where they can have physician direction directly. So to that end, most of our labors and deliveries are attended by our certified nurse midwives. And that's even if you're trying to VBAC, because midwives are experts in labor and delivery. And we're going to make sure that you're in optimal health to get there and have a safe labor and delivery. Now, if something happens during labor or delivery that is outside the scope of midwifery, then they call the physicians in. So physician consults are if it's something urgent, and by urgent we mean not going to be scheduled for tomorrow or whatever. Something that needs to happen but can wait like maybe 15, 20 minutes for us to come in to the hospital. If it is something emergent, meaning you don't have 15 or 20 minutes, where we deliver, there are OBGYN physicians who are in-house 24 hours a day just for emergencies. Those OB hospitalists are there for if you need to be in the operating room within 5 minutes. To put it in perspective, though, we did about 600 deliveries in 2024. We used the hospitalists 4 times. And what I'm excited about is since that time, our hospital has actually employed the midwifery model in its hospitalist unit as well. So four of the times that we used them, 3 of those times were because the baby was coming out really fast and whoever was from our team wasn't able to make it to the bedside fast enough. Now they have midwives as hospitalists. So no matter what, you're going to have a midwife who is delivering. Where is this wonderful place? I'm so glad you asked. We deliver at HCA, which was formerly known as Memorial. HCA has taken it over, renovated the whole thing, and it is fantastic. We're going on our 3rd year there now. We were at Ascension before for 9 years, and the move to HCA has been very supportive of our philosophy of care and birth and physiologic birth. It's less than 10 minutes from our office, and we invite you to go take a tour. We have quarterly store tours. The next one coming up is on the 20th of this month, but it's already full. It's sorry. The next one after that, though, is in November. So when you come in for your visits, you will see these brightly colored flyers on the wall with information to sign up for the next tour. If you missed that one, don't worry. The next one is February. Actually, I think this group is probably due close to that time. So try to do the November one. If you can't make it to these quarterly dates, we do tours every 2 weeks. It's just not the big party of the stork tour where they raffle off prizes and doulas have vendor fairs and all that good stuff. You just go to the HCA website, select register for a class, pick labor and delivery tour, and one of the childbirth educators walks around small groups of like 7 to 10 people every 2 weeks. Our office, the Full Circle office, is open Monday through Thursday from 9 a.m. to 1 p.m. We close for lunch from 1 to 2. During that time, the phones are rolled over to the after hours line. So if you call between 1 and 2, don't worry, we haven't abandoned the practice. But the reason why we have it roll over is because after hours, it automatically rolls to the on-call emergency person. So if you have a medical emergency between 1 and 2, it's set up so that you can still reach somebody, like one of our providers, between 1 and 2. Now, she is the person who is in the hospital, rounding on people, taking care of emergencies, delivering babies, all that good stuff. So she doesn't take administrative messages. So if you have something administrative, I'm going to be late for my appointment at 2:30, don't leave that on the call phone between 1 and 2. Just wait until 2 o'clock. Give us a call back, and the front desk will accommodate your administrative issues. When we reopen, we are open from 2 to 5, Monday through Thursday. On Friday, we are open from 9 a.m. to 1 p.m. So if you are calling with something administrative on a Friday at 12:53, we may have to answer that question or address that concern when we reopen on Monday at 9 a.m. In terms of appointments, we don't have walk-in appointments because our goal is to see you at as close to your appointment time as possible. And if I promised you the 10:40 slot on a Tuesday and someone decides at 10:27 that they need to come in and be seen, that's going to push your appointment back. That's not fair to you and to your time. We respect your time. And so we ask that you do the same for your fellow patients. There are some limited same day openings. Sometimes people cancel, sometimes people deliver, sometimes people forget. And sometimes if you call in the morning and you say, actually, I have a need that I need to be seen today, our preference is to give you a time to come in so that we can see you at as close to that time as possible. If you're calling with an urgent matter, say it's 9:30 in the morning and you're saying, I'm not feeling my baby move. We look at the calendar and we see their next available spot is at 2:30. We're not going to have you wait, 5-6 hours for us to check on your baby that's not moving. We'll probably recommend that you go to labor and delivery to get checked out. If you're having chest pain, shortness of breath, that shouldn't be sitting in our lobby waiting to get worked in. We are also a well office. I think all of y'all are going to be pregnant during cough, cold, and flu season. So if you have cough, cold, and flu, please don't come in here with that. We are a well office full of immunocompromised pregnant women and people who have to take care of immunocompromised pregnant women. So if we recommend that you go to an urgent care setting, it's not us saying we don't want to take care of you. It's us protecting the other patients here and making sure that you're in the appropriate place, because chest pain, shortness of breath, you need a chest x-ray, you need an EKG. We don't have those things here. So if the nurse says go to the hospital, then it's go to the hospital. When you call, the providers aren't able to leave patient appointments in order to take phone calls. We are seeing the people who we promised that we would see at their appointment times. If you leave a message, though, or front desk will, tell you whether it's something appropriate to put in the patient portal, you will get a phone call back from us. When you call and leave a message, be sure you're leaving it in the right place so that you get the right response. So if it's something pregnancy administrative, not clinical administrative, so letters and forms. Jennifer and Kylie are here physically in the office, so they are typically the ones taking your triage calls. Is this something I need to schedule an appointment for them today? Can it wait until tomorrow? Do I need to send them to the hospital? That's kind of their triage situation. Naisha is our clinical coordinator. So she is helping asking you to get your referrals done. Let's say you need to see the high-risk doctor, you're anemic and need to go to hematology for IV iron infusions, cardiology, what have you. She gets all of those things coordinated for you, follows up on the reports, so that we can continue to take good care of you based on the advice of our consultants. If at the end of pregnancy you need something scheduled, like an induction or your C-section or a version or even baby circumcision, Naisha is the one who coordinates all that for you. And most of you met with Renee Hall, not Tiffany, in that video the other day. And if anything changes about your insurance, please let her know, because she's the one who makes sure that we're not continuing to collect on an unnecessary payment plan, or that you're not going to get a surprise amount. Our goal is to try to get you the most information based on the information you give us. If it's after hours, you still call the same number that you call to make an appointment, the regular office number. Like I said, it rolls to the emergency on-call provider. So this is who you call if you think you need to go to the hospital. Like, she's not filling prescriptions, she's not reading back to you what the other person recommended during their visit, re-explaining ultrasounds. She is there to see you at the hospital, and you have to leave a voicemail in order to receive a call back from her, because the phone doesn't register that a call even came through unless a voicemail is left. The patient portal is another way to reach us, but please remember that response times can take up to 2 business days. So if you send a message on Thursday, the next business day is Friday, the next business day is Monday. So don't send anything on Thursday that you can't wait until Monday for a response. If it's a non-action item, just wanted you to know you might not get a response at all, because you just wanted us to know. So now we know we might close it. Or if it's something, I was wondering whether these vitamins are okay, we might recommend, hey, bring them to your next visit and we'll talk about it. And that's a non-action item. Like, it doesn't need any action right at this moment. So we might forward it to the person who's going to be seeing you next. The portal is best for action items. Like, I lost my lab slip, I need to go to the lab, I don't want to waste a trip. Let us email you another copy of it. Or have an upper respiratory infection, I need to convert my visit to virtual because I still want to be seen and tell you how I'm feeling, but I can't come into the office and make everybody else sick. Remember that I said that. Things we don't want to see on the portal: urgent matters, because remember, 2 business days. So if you don't feel your baby move on a Friday, don't put that in the portal, because I'm not going to see it possibly until Tuesday, 2 business days later. That's something that needs to be addressed. That is an urgent matter. If your blood pressure is high, because y'all are still doing this, please do not put high blood pressures or heavy bleeding in the portal, because again, that's not being checked. You're not texting us directly on our phone. And if we're off, like, you might be texting someone who's off. I'm with my family, I'm not checking my portal. Don't send blitz messages. So blitz messaging is when you say, all right, 9 people work here, I'm going to send the same message to all 9 people. That is abuse of the portal. And also multiple messages to one provider or to different providers, especially about the same subject. We had someone very upset. She went to the pharmacy and there were 5 different prescriptions waiting for her. And why are there so many? Well, you messaged 5 different people and we're all very helpful. We want to help you, but it's not a good, efficient use of our time for all of us to be doing something for one person when one person can do it. Send a message. If you don't hear from her in 2 business days, if you still have 2 more business days to wait, like it's about a form or something, then send another message. If you don't, then it's time for a phone call to the office to talk to someone. We also ask that you don't try to have a visit, like have an appointment over the portal. So if you're asking, hey, can you go through risks and benefits and pros and cons and let me know what the research is? Can you review these articles and let me know? That's an appointment. The portal we should be able to respond to you on the portal in 30 seconds. Because I'll tell you, my portal inbox stays full. Like, I will go see one patient, I may answer some messages between patients. I'll get it down to 2 or 3 messages. I'll go see a patient, come back, there's 25 messages there, because people are always messaging. So if it's not a very quick answer, then we're going to try to figure out how to set up a situation where you can have a longer conversation with us. So text yourself questions, start a text thread so that you can bring all those questions in to have real-time, long, satisfying answers, or schedule an appointment. We'd love to see you here in the office. Ultrasounds are also sent out on the patient portal. They're always unless there's something urgently abnormal about it. Our sonographers have been doing this for decades, really, and they know what things shouldn't just walk out the door without a plan. They'll interrupt our day, come and get us, and say, "Hey, you really need to talk to her. Don't let her leave." Otherwise, we don't have their reports immediately. It's just like if we sent you out to a radiology facility. The ultrasound techs have to complete their reports. The medical assistants download the finished report from the ultrasound machine into our electronic medical record system, divide it between all of us, and then we review it and send it out to you. So give us 2 business days to receive the report, review it, and send it out to you. Now, if you know your anxiety will not let you wait 2 days to see what's on the report, that's fine. I encourage you to schedule your OB visit on the same day after your ultrasound report, because the techs can print out a preliminary report and we can go over it with you in the visit. I do that like almost all the time. But give us a chance to receive it, review, and then and release it to the portal for you. Quest and Natera also have portals, and because of Affordable Care Act, as soon as the result is finalized, they send it to you and us, boom, in the same moment. Only difference is you're up at 2 in the morning because your baby's not letting you sleep and looking at your portal. And so you open it up, you see red, all these different things, and it freaks you out. And then you start Googling. And then by the time we, see your portal in not the middle of the night, like the next day, you've already diagnosed yourself with something. You buy extra health insurance, and you figured out what cures you need us to send in. Deep breath. Red does not necessarily mean abnormal. Remember that the reference ranges that they're using for these labs are for non-pregnant people. So when you're pregnant, there are some changes in your body that make certain abnormal values normal in pregnancy. So give us a chance to receive the labs from the lab, not from you. Don't upload your labs to us and say, "Hey, look at this." Give us a chance to receive them from the lab, review them, and release them. 9 times out of 10, you're going to see a little message on there that says the ones that are out of range are actually okay for pregnancy. And if it's something that needs an action item, then we'll write about that as well. If you've had the labs for like a week and you haven't heard anything from us, let us know, because there's a possibility, like sometimes the lab sends it to you and not to us, or they send it to us and it doesn't sort into your chart. Like, we don't have a fax machine here. Everything goes to Massachusetts and it looks for your name, your date of birth, and another identifier. If you have not changed your name, or you use a different name at the facility, so you go to the lab and you're, Susie Johnson, but here you're Susie Thomas. Susie Johnson's labs come in here and our chart says, "I don't know who that is," and they don't go into your chart. So name consistency, please use the same name at all facilities, all consults, every place you go, please be Susie Johnson. And ideally, be Susie Johnson at your insurance company too, so that your insurance company will know to cover all of your visits. But using alternate names definitely guarantees delays in receiving your information. So there are no questions on how to contact us. Next is what to expect at your visits. So first, expect that after you hear your baby's heartbeat, you're going to forget all your questions. It happens all the time. So that text thread that I was talking about, go ahead and start texting yourself questions. Like every time you think of something, just, I'm going to text myself so I can remember to ask her this when I go in. Wear loose, comfortable clothing, because every time you come in, we are going to listen to your baby's heartbeat, not an ultrasound, but listen. We're going to use the Doppler to make sure that we can hear your baby's heartbeat. If for some reason the Doppler can't find baby's heart rate, then we'll take you to, take a look on ultrasound and make sure everything's okay. So we need you to get here about 5 minutes before your scheduled appointment time, so you'll have time to hang out at front desk and handle any insurance stuff that they have going on. And if you need to leave a urine sample or just go to the restroom, you'll have time to do that too before your appointment time. We're not universally checking urine on everybody. American College of Obstetricians says to stop doing that. So really, we're going to find the people who need urine samples are those who have had high blood pressures and we're looking for protein, or high blood sugars and we're looking for glucose, or you had a recent urinary tract infection and we're doing a test of cure. Otherwise, we know you've been drinking your water all day. Come on in, go to the bathroom, and come out so we can see you at your appointment time. Now, if you're 10 minutes late, We still have time to check on you and your baby, but that leaves less time for our little text thread here. 10 minutes is the end of our grace period because the whole appointment is 20 minutes. So, 20 minutes, you missed your whole appointment. We may be able to work you in later in the day or reschedule. Now, there are times that traffic is terrible and everybody's 10 minutes late. Front desk is watching that, and that's okay. But we also want to be, again, mindful of the person who's coming in on time behind you, because if you're 10 minutes late, it's 5 minutes before the next patient is showing up for her appointment to get checked in. So again, with the openings in the day, front desk is good about saying, she's going to miss that appointment with Sade. We need to move her over to Amanda's schedule 20 minutes from now. If that time works for you, great, problem solved. If there are no times that work for you on this day, except for that one time that you weren't able to make, then we'll get you rescheduled to another day. That's no problem. All right, diagnostic ultrasound visits. So when are we going to get another ultrasound, Dr. A? Excellent question. Just know that diagnostic ultrasounds are separate from your prenatal visits. So how do you know if you have an ultrasound scheduled? Again, great question. Do you have more than one appointment time? And is there a provider's name associated with your visit? So these are things you can find on your patient portal. This is Tina Test. She's my imaginary patient. Tina logs in and she clicks on appointments. And Tina sees that she has 2 appointments on the same day. The first one at 9:20 is with ultrasound, which is not a provider's name. So Tina knows she has an ultrasound. Then her 10 o'clock appointment is with Dr. Yeckel. Dr. Yeckel is a provider's name. So Tina knows she's going to get an ultrasound, and then Dr. Yeckel will be able to go over a preliminary printout of what the report is to answer her questions right then, and then she'll get her full report within 2 business days, unless there's something urgently abnormal, in which case we will, like if she doesn't have an appointment with a provider scheduled on that day, we'll break our schedule and figure out how to come and talk to you and make a plan for what needs to happen next. So if you're checking out for, like it's your 16-week visit and it's time for you to come in for your anatomy ultrasound next time, let the front desk know when they're scheduling your next appointment. I need an ultrasound visit and I need a regular prenatal visit. Now, if you just want an ultrasound visit, like you don't medically need one, because remember, these are diagnostic ultrasound visits. We're looking for stuff to make sure that your baby is okay. But you just want to look at your baby because your baby is cute, that's fine too. There are boutique places all over town that are just waiting to look at your baby. These are 3 for informational purposes, not endorsing anyone over the other, but they do all sorts of cute stuff like the 3D ultrasounds and put the heartbeat in a stuffed animal, and your whole family can come sit in a movie theater. They do gender reveals at like 14, 15 weeks. So take a look at these places if you just want to take a look at your baby more than we medically need to take a look at your baby. All right, so we are going to slide over now to fullcirclejacks.com. Let me know if you are able to see the website now. Give me a heart or a thumbs up. You can see Full Circle Jacks. Okay, fantastic. Okay, so this is our new revamped website. So if you guys saw the old website before, just wait. This is amazing. All right, so we're going to start here with the people and how fancy it is. And then there's a quote from somebody we all know pretty well. And then here are our shining faces. So you'll see me, my partner, Dr. Marrow, Dr. Yeckel, Dr. Mooney, the midwives over here, and yes, and Sade. So there's office team and there's hospital team, and it's all kind of mixed together. So you have to click on the things to find out whether we are office/hospital or just office or just hospital. So there's a little mystery there to find out who you'll be able to see in different places. And over here under obstetrics, you will see a lot of different boxes. So we're going to take them one by one. So delivery statistics, this is why a lot of you are here, because you are looking to avoid unnecessary cesareans, or you're looking forward to possibly avoiding a second cesarean. And this, we are very transparent with our numbers, like how many of our first-time moms, what is your chance of delivering vaginally with us? How many of our VBAC moms, what's your chance of having a vaginal delivery if you've had a previous C-section? And our numbers are out here back to 2018, because that's when Dr. Mara joined me and made me organize all my numbers. But we're going to click here on the prenatal care timeline. So this kind of gives you what to expect trimester by trimester, depending on your weeks. So everyone on here here has had their first visit, which is our confirmation of pregnancy bundle, which we like to do between 8 and 10 weeks because most of the bad genetic stuff that happens to end pregnancies happens prior to 8 weeks. It can happen afterward, but it's a lot less common. So there's a reason why we do things in a certain order. And at that visit, you see Taylor. She gives you your due date. You meet with a midwife, talk about any urgent things, and she tells you you're going to have 2 visits. One is a Zoom call with Dr. Adams. Another is a physician review of your medical history. If you are going to need to take off work during your pregnancy, or if your support person needs to take off work, consider intermittent FMLA. That's a good thing to start thinking about at the beginning because you should have protected time to come to the prenatal visits that you need to make sure your baby's healthy. About 2 weeks or so after you have your pregnancy confirmation, anywhere from 1 to 3 weeks really, you have a virtual visit. Right now, the majority of them are with me. And that's where we go over your medical history, your pregnancy history, genetic history. If there's anything in there that says, whoa, she needs to see a specialist, that's where we make those referrals. And Naisha starts to handle that. We make sure that the labs that you're going to get are appropriate. These are our standard prenatal labs. We are also very lab transparent here. It's people transfer and they're like, I don't know what labs I've done. Here you will know what labs were done because you have to agree to them. So these are the standard labs. And then the optional labs down here have to do with genetic testing. Baby at risk for Down syndrome, is it a boy or girl? Those aren't things that affect how we take care of you, but just things that you might want to know. And then roughly 4 weeks after you have your confirmation visit, you're back in the office for your OB physical. The physical is just like it sounds: heart, lungs, breast exam, pelvic. Doesn't necessarily include a pap test. The pap is the screening test for cervical cancer that we do every 3 years. If you're not due for one, you don't have to have one just because you're pregnant. If you are due for one, you're welcome to have it done during pregnancy, but because it's not part of the panel, it's not required. We just need cultures, cervical cultures, because those are part of the standard prenatal planning. And then if you need to see a high-risk doctor, they usually start seeing you between 12 and 14 weeks. This is when, I know it seems early, but the doulas have told me, don't let these people wait until the 3rd trimester to find us. And someone you want to build a rapport with. We'll talk about doulas a little bit later, but you want to start thinking about whether you're going to use a doula in your 1st trimester. 2nd trimester, you have some more optional testing that tells you different things about baby's spine development, and we'll talk to you in depth about what that is at your visit. You'll see mental health screen over here as well. And this is the time when we do your anatomy ultrasound between 20 and 22 weeks. When you meet with your office team, we start talking about options for childbirth education, breastfeeding classes, and there's a link here to tell you how to order your breast pump because a lot of your insurances cover it, and I'll talk about that in a moment. Around 24 to 28 weeks is when we do the glucose test, and I may have questions about that, so just put a pin in it. I'll come back to it. For my moms with a certain special blood type, we make sure that we have RhoGAM, if necessary, to give you between 28 and 30 weeks. And again, we talk to you individually about what that means. This is when you're going to pre-register at the hospital. So everything is online now. For those of you who were with us at Ascension before and you filled out the papers and just mailed them off, snail mail, everything is online now. And so we have a QR code for you to scan and create your HCA portal. And make sure that you've seen the hospital so you know where you're going, so you don't accidentally have your baby in the parking lot because you couldn't find it. Now we're moving into the 3rd trimester. So this is when it really starts to ramp up, and we begin to see you every 2 weeks. So you have the option, the College of Obstetricians recommends doing the routine prenatal labs at least once. In certain high-risk populations, it's recommended to repeat them later in pregnancy. Totally up to you. If you feel you fall in the high-risk category, go ahead. Or if you just are a rule follower and you get all the labs that everybody says to do. But if you say, nah, I don't feel like I need to do it again, then there's a form you can sign, and it has the risks and the benefits of all of that. First-time mamas, this is when you want to start looking around for a pediatrician. Veteran moms, if you want to stay with the same pediatrician, you want to, if you plan to change, then this is when you want to start looking around. We'll talk to you about recommended boosters for vaccinations in early 3rd trimester, which we don't give here in the office, but if you want to get them, we give you education on them and tell you where you can go. Again, right around now is when you want to start talking to HR at work about FMLA and leave and short-term disability. If you have any pregnancy-related complications like high blood pressure or diabetes, we start doing testing on the baby. If you know you're having a belly birth, which is our term for the cesarean, we usually give the information to our OB coordinator, Naisha, when you're around 32, 33 weeks, so she can plan to get a date for you. Then we continue the every 2 weeks until 36. This is when we start seeing you every week. So you're full term at 37 weeks. So at 37 weeks, we start seeing you weekly because you're full term. If you want to make a birth plan, we're going to go through that in a minute. This is when you can start bringing it in because you're no longer preterm. So everything's back on the table. We do a screen for group beta strep, and we'll tell you what it is and why it's important. And then if you opted out of repeating some of your STI screening, you can also opt out of the repeat swabs. And then if you're having a belly birth, those typically occur between 37 and 39 weeks based on your individual circumstances. And then those who are waiting for labor, for baby to give the signal, you do this part right here. Be patient, be patient, be patient, because everybody calls you every day. Have you had the baby yet? Have you had the baby yet? Like, you're going to forget to tell people you had the baby. And we like all passengers out of the car by 42 weeks. So if you're a first-time mom, usually we will set induction for 41 weeks and 5 days. If you're an experienced veteran mom, 41 weeks and 6 days. Because the average, and you can print out the prenatal timeline as well. The average, the average time that first-time moms go into labor is 5 days past your due date, and your average length of labor is 24 hours. So if we have to induce you, then it's probably going to take us 24 hours to get you into labor and then another 24 of laboring. So we do 2 days before our 42-week deadline. For those of you who have some of these common discomforts of pregnancy and wondering what it's okay to take over the counter, when y'all send me a message and say, oh, Dr. Adams, I'm very constipated, or I'm really dizzy, first thing I'm going to ask you is, have you looked at the website to see if there's anything that you can take for that? And some of y'all have gotten really smart. Hey, I've already done this, 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 and this. I'm at the end of what's on the website. And that is an appropriate time to message us. If you've done everything here, obviously with some caveats, if you're having nausea, vomiting, can't keep fluid down for 24 hours, don't keep trying C-bands and acupressure. Please let us know because you need some IV fluids. But these things have little color codes down here, like who shouldn't take what and all of that stuff. But just remember that this is out here and also printable. Diabetes screening, like I said, I'm going to get back to this in a moment, but remember this is between 24 and 28 weeks. But these are the instructions on how to prepare for glucose testing. We will remind you that these are out here, but I'm saying it slowly now, repeatedly, because people always say, no one gave me any instructions. And so I had 3 hamburgers before I came in. So obviously 3 hamburgers before a glucose test is not a good idea, or really at all ever. But yes, don't do that. This tells you what to do before your glucose test. And we'll remind you what it is. And it goes over what the patient-driven options are too. Weight gains. Are very concerned that they have not gained any weight in their first trimester. Don't worry, that weight is coming. So this is how we can calculate our pre-pregnancy body mass index. So you put your weight and your height in here, and it tells you what your pre-pregnancy body mass index was, and that tells you how much weight you should gain based on that. If you have twins, you can add 10 to 15 pounds to the upper limit here. And so you'll see over here what our twin numbers are. The thing I want to highlight, though, is that those numbers are for second and third trimester. First trimester is survival mode. You're craving carbs. Everything is awful. You're averse to everything. Don't worry about it. You may even lose a little bit of weight. That's okay. Second and third trimester is when we measure what your gain is by the weeks, because that's when your baby really puts on a lot more of his, her, or their weight. Birth preferences. Want to make a birth plan? Here we go. Here is a template full of stuff that we in the initial phases of the practice, over a decade ago when we started Full Circle. These are the things that we would see come up over and over again. So this is interactive. So as you look at each scenario here on here, you can decide which things you would like to try. And you can click them off, and then it saves it. And at the bottom, you can print out your birth preferences and bring that in after your 36-week visit to go over with your office team. And we'll kind of talk through expectations at the hospital, what it looks like what does it mean to be intermittently monitored? How many minutes off, how many minutes on, and do I have to be connected to this, connected to that? So those are things that we want to talk through with you so that we're setting good expectations for when you get to the hospital with our hospital team, because they're all ready to do exactly the same things that we talked about here. But we tee it up for them to knock it out of the park. Cervical ripening methods. So at the end of pregnancy, when everybody's calling you every day and saying, have you had the baby yet? You're secretly at home trying everything you can to get labor to start. And so these are all things from evidence-based birth that we put in one area, and whether the research is good or whatever, but I promise you at the end of pregnancy, you don't care about how good the research is. You will try everything. What is not on here? Castor oil. Ask your office team why. Ask your hospital team why, because they're the ones that catch the end of that. Breast pumps. Remember I said there's a link on here to ordering your breast pump. This literally takes you to the website for you to put in your insurance information. They write the prescription and send it to us. All we have to do is sign it. It's so much easier for us. So please use our form. Don't go looking for your own, because I promise I get a message at least once a week of someone who's really frustrated with whatever company they found to help them order a breast pump. Just go with these people. All right, how many first-time moms do I have here? Let me get a heart or a thumbs up or something so I know if I have any first. Okay, all right, I see you're out there. What about moms who had a prior C-section? How many of those do I have out there? Let me get a heart for my VBAC mamas. Okay, good. I was like, oh no, crickets. Okay, cool. First time moms and VBAC mamas, y'all have the same goal basically. You're trying to avoid meeting me in the belly birth suite. So those of you who had a belly birth before, it's unpredictable. Babies are going to baby, but control what you can. So these are things that you can do to make sure that you're on the right side of putting in as much effort as you can to avoid a cesarean. So for those who've had a belly birth before, fear release is huge. Like trying not to let your past birth experience sabotage what happens in your next birth experience. Everything else though is for everybody. So heavy on the, exercises, squats we'll talk about in a moment. Experienced doula. Emphasis on experience. Please don't cheap out here. Am I saying the cheap man pays twice? This is not some time to just have somebody who just holds your hand and tells you that you're pretty. That's what your partner's for. The doula is there to put you through the paces, get you in different positions to get your baby's head to not be crooked. I cannot stress enough that the most common reason we do C-sections is not baby's too big or baby's in distress. It is baby's head is crooked or baby's head is down, but the back is toward mom's back. Please look at all of these resources to try to avoid your baby being in a position that increases your risk for cesarean delivery. If you have a little guy and you decide you want to have him circumcised, we don't do those in the office. Those are done here in the hospital. Sorry, those are done here in the office until he's 10 days old. And Naisha is the one who coordinates that for you. We'll ask you after you deliver, and then she'll send you a message with this little appointment time. And all the rest of these things are specific to what happens to you specifically. If you need to be induced, if you're having a belly birth, and then what to expect postpartum. If you had a cesarean before and you are looking to VBAC, you'll want to come here to the release to Full Circle Women's Care so that we can get your operative reports and move things along there. Okay, we are going back to the presentation. And guess what we're going to talk about? Nutrition, right? So for those who are concerned, because some of y'all are concerned that you have not gained any weight, and then there's some who are like, why have I gained so much weight? All I'm drinking in the morning is coffee. Is it coffee, girl, or is it the salted caramel mocha monstrosity, which is absolutely delicious? Anyway, did you know pregnancy only requires an additional 300 calories a day? That's it. So all of this, I'm eating for two. No, if you're eating 2,000 calories, your baby does not need 2,000 more calories every day. It takes 10 calories to maintain a pound of body weight. Think about how much your baby actually weighs, and how much has to go toward placenta and burning energy and all of that. Your goal weight gain, remember, is based on your starting body mass index. So if you're starting at 170 pounds, and let's say your goal is to gain 25 pounds, you get 250 extra calories. And so your 1700 to maintain your weight plus 250 gives you 1950 for the day. Divided between breakfast, lunch, and dinner, that's 650. Remember that mocha monstrosity that was 570 calories? That's like almost a meal. So don't drink your calories. Once you've eaten your 650, have some water to wash that down. This next slide is just kind of a, well, where do those calories come from? How much protein, how much carbohydrates, how much fat, and what kinds of fat, saturated or unsaturated. But over here is also an example of what small changes can make. So just going from traditional spaghetti sauce to 20-minute herb infused marinara, which is still delicious, you can cut out 500 milligrams of sodium per serving. That is going to be very important to you in your third trimester when your fingers start swelling and your rings don't fit anymore. So what should you eat? Fruits, veggies, whole grains, cereal. You're not going to give your baby a nut or dairy allergy by eating those things, so carry on. For my coffee drinkers, everyone seems to be on top of this less than 200 milligrams per day, and that makes me really happy. Also remember though, caffeine is a diuretic. So if you're drinking 200 milligrams a day, use the 3-to-1 rule, and you need to have 3 times as much water as caffeinated beverage or food. Herbal teas are fine, and some of our favorites in pregnancy are raspberry leaf, ginger, lemon, and peppermint. For my pescatarians, my vegetarians, you want to make sure that you're getting your protein in. 70 grams per day is your sweet spot. There are some pregnancy diets that encourage you to take in about 120 grams of protein a day. Please don't do that. You are going to have a 10 or 11 pound baby, and that makes life harder for really both of us, honestly. You can have deli meat. Yes, you can. Just be sure that you microwave it for 30 seconds to get rid of any harmful bacteria. Who knew we'd have to talk about lettuce having harmful bacteria too? But cheeses, your soft cheeses, as long as they're made with pasteurized milk, they are fine. If you can't flip it over and verify, Trader Joe's or whatever that's pasteurized milk, then please don't eat the cheese. Canned tuna, you can have 3 4-ounce cans per week. If you need more fish than that, maybe you're pescatarian, I don't know. There's a nice document on the FDA. I know it says 2021, but they haven't updated it since then. So these are still the good fish. So the ones that you should eat in larger quantities because they have DHA in them, which is good for baby's brain development. The ones that are kind of neutral, so you can, eat them in moderation, and the ones to avoid because of high methylmercury content. Whatever kind of fish it is, be sure it is cooked all the way through. So none of that yummy ahi tuna sushi that you love so much. You can have the cooked sushi, but not the really good stuff. If you're a foodie like me and you like your steaks medium rare, sorry girl, you're going to have to ruin your steak for the next 6 months, and then you can have a medium rare one afterward. Kombucha drinkers, kimchi eaters, sauerkraut, all the fermented things, those are fine in moderation, but we don't know what moderation is. So remember, the fermentation process is kind of very similar to what we use to make alcohol, and we say no alcohol. So and there's no safe quantity of alcohol that we know, because fetal alcohol syndrome doesn't have a specific once you hit this threshold. It's all about your metabolism. And then you want to keep your sodium under 1,500 milligrams a day. So think back to that herb infused marinara sauce. 500 milligrams is major to cut out of a regular serving. All right. Oh, we have some questions up here. All right. When do you start the exercise for correct baby positioning? After your anatomy ultrasound is a good time to start, because that starts to train your pelvis for when baby starts to descend in the third trimester. And then, do you need a release for VBAC if you've already had 2 successful VBACs? If you had them here with us, no. But if this is your first time VBACing with us, we still want to take a look at either your old operative report or your old VBAC report, just something that proves that you had a safe scar for us to labor. All right, good question. Sorry, I missed those. I didn't see those out there. All right, we're moving on to exercise and pregnancy. So it is fine to continue your pre-pregnancy activity, unless your pre-pregnancy activity was doing nothing. But you just won't feel like it in your first trimester. So second trimester, there are a lot of physiologic changes that help you to accommodate more activity. Your blood volume increases by 50%. Oxygen tension and saturation increase. So just listen to your body. You're winded all the time in your first trimester. trimester. That's normal. You don't have enough oxygen. That's why your body goes and gets some more in your second trimester. If you weren't doing anything before, no judgment, a little judgment, but it's okay to start a new regimen, because remember, a sedentary lifestyle leads to a malpositioned baby, and a malpositioned baby is the most common reason that we have to do C-sections, and we don't want to do them just because your baby is being sunny side up and nosy. Turn your head over, little one. All right, if you have one of those little cute Fitbit watches, you have a resting heart rate that you're watching a lot. It's normal for it to go up by 10 to 20 beats per minute. That's a normal physiologic change of pregnancy. As long as you're not getting lightheaded or dizzy from it, you are fine. Question I have here on the floor. Today I noticed my Miralax bottle says stop taking after 7 days. Should you switch to something different if still experiencing constipation in first trimester? Short answer, yes. So no more than a 7-day stretch of Miralax. You can switch to something else, because really what happens is you develop a tolerance or dependence. And so you switch to something else. You can go back to Miralax later, but you want to train your body off of it for 7 days. And then if you need to go back later, it's fine. Question. And the constipation stuff is, again, on our website. So exercise in pregnancy. If walking is your exercise, that's fine. Just be sure that your heart rate is in the aerobic zone, which is 70% of your max heart rate based on your age. So if you're 30 years old, 220 minus 30 is your max heart rate. So you shouldn't be exercising for prolonged periods of time with your heart rate above 190. 70% of 190 is where your aerobic zone starts, though. So if you're walking, your heart rate needs to be between 130 and 190 for 30 minutes sustained 3 times a week. That's your aerobic exercise goal. If you're like, oh, I'm walking for exercise, and your heart rate is still hanging out between 80 and 100 where it always is, you're walking for transportation, which is important too, but it's not exercise. So we'll talk about what exercise actually is. Next question I have. Ever since I entered 9 weeks, I can't hold anything down, scared to eat anything. Juice comes up, pretzels come up. Usually not, like it starts to get better in your 10th week. So if you've been fine until 9 weeks, talk to us about that at your next visit, because we want to make sure that there's not another reason that you're having nausea, and not like if you have reflux or something that's starting at 9 weeks. Next question, should I wait until after I heal from my cervical stitching in the second trimester to exercise? Yes, and you will have guided exercises and things that we'll say that you need to avoid doing. So that's a topic for your individual visit. Next question, had a belly birth for my first baby and would like to have a VBAC. How far into the pregnancy can I wait before being induced? Same as everybody else. We still want everybody out by 42 weeks. VBAC doesn't change when we want you to deliver. So in terms of exercise in general, not for you, cervical stitch lady, we'll talk about your individuals. Like some of this stuff is okay for you. But cardio, treadmill, elliptical, swimming, running, like swimming is awesome because your belly is weightless, your joints feel amazing. Indoor bike, like if you're a Peloton girl, go for it. All of these are great. You can weight lift whatever you were lifting prior to your pregnancy, but just be sure that you don't need to increase your resistance. Your baby and your body are going to do that for you. Squats are my favorite, y'all. Get those hips open and let that baby descend into the pelvis. So if you are an experienced squatter, you're already doing 50 plus squats a day, go for it. If you're not, though, at 20 weeks, you start giving me 5 a day. 21 weeks, you give me 10 a day. 22 weeks, you give me 15 a day. If you have prenatal visits with me, there are times that I will quiz you. You come into that visit and I'm going to say, all right, as we talk about stuff, stand up and do some squats with me. So, I tell people that and I didn't think you were actually going to do it. And they try not to book any more visits with me, but I'll find you and we will still do squats together. Pilates and yoga are also 2 of my favorites. Again, anything that gets those muscles open, long, and lean, and any experienced instructor will be able to tell you what the pregnancy modifications are. The things you want to avoid, the high intensity interval training after your first trimester. So it's not the interval, it's the intensity. You can still do the low impact version of a lot of those, and believe me, that will still get you winded because pregnancy. Anything that has you lying flat on your back for long periods of time, like ab work. You can do side lying abs, you can do standing abs, but just not on your back exertion abs. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, you will get dizzy and you may fall, and we don't want you to fall on your belly. You also want to avoid scuba because of changes in barometric pressure being dangerous to the baby. High altitude hiking. You can visit Colorado. Places that are 8 to 10,000 feet above sea level are fine, but just nothing exertional while you're up there, because less oxygen up there, and you need more oxygen for your baby who's stealing your oxygen, and you will again get dizzy and pass out. Contact sports, please don't start that now. Don't start kickboxing and all of that stuff now. Nothing with a ball flying at your belly. Outdoor biking after 16 weeks is not a no. It's just a be careful, because at 16 weeks is when your center of gravity changes. Y'all start to get that little wobble. That wobble means that we need to do something about your hips, but I digress. Just know that as you start trying to turn corners, you may, because your center of gravity is different, fall over on the bike instead of actually nailing that corner. Questions I have a simple cyst found during IVF. I was a runner prior to pregnancy, but asked to stop until consulting my OB. So typically after you get out of first trimester into second trimester is when our experienced runners, we tell you go ahead back to it. And next, does the hiking part apply to all trimesters? I'm going to Colorado for 2 weeks. Yes, the hiking applies for all the time. I lived there for a long time and hiked while pregnant with my first baby. Now, if you're living there, it's different. If you're here and going to a different environment, you've gotten used to what the oxygen content here at sea level. It's a lot different going back. So be easy. Give a little bit more info on what a HIIT workout would be. 15 minutes, 40 seconds on 20 seconds. Yes. So yes, I mean, those are the intervals. Like the interval is fine. Like whatever the interval is, it's the intensity, the sudden jerking movements that tend to be associated with HIIT workouts. Those can also create a situation where you're shearing the placenta off the side of the uterine wall and creating bleeding. So do the low impact, easy movement version of it. Great questions. All right, so we've talked about diet, we talked about exercise. It's the perfect time to talk about glucose screening, right? Because most people believe that you can just avoid gestational diabetes by just having a good diet and exercising well. No. Do you know what causes gestational diabetes? Your placenta. Your placenta is the most celebrated villain of this pregnancy. It's a superhero and a villain. It's giving off hormones all the time. You know how we blame our hormones for everything all the time? In pregnancy, girl, same. So except the hormones come from the placenta. So the placenta gives off hormones that tell your insulin, you don't have to do your job today. And your insulin's job is to clear your bloodstream of glucose, bring it into the cells to use for energy. But you got this placenta saying, call out sick. You don't need to do that. And so then your insulin doesn't do its job. And now you've got all this extra glucose hanging out in your bloodstream. And what is extra glucose in your bloodstream? Diabetes. Yes, it is. But it's gestational diabetes because it's diabetes due to your placenta. And if you have twins, you have two placentas. So you definitely need to be screened. For my moms who say, but I never eat anything with sugars at all. You eat fruits, you eat whole grains. Don't avoid those carbohydrates prior to the test because they will, they'll give you a false positive. If the drink itself is what bothers you, we have the Simply Pure drink here. It's on back order currently. It may be back by the time you guys are in the 24-week range, but it's soy-free, dye-free, gluten-free, BBO-free, kosher, vegan. Like it's offensive to almost no one. We also, though, have begun to stock the fresh test. So, and we have it at lower prices because we get it wholesale. Then you will pay for it online. So if the fresh test interests you, that's something you can do too. And remember, our website has the other patient-driven options and links to those as well. When you're talking to your office team about childbirth education classes, so these are method classes. So this represents hypnobirthing, hypnobabies, Bradley method. I think Lamaze is on there too. But again, if you start Googling any of these, the algorithm will know that you're searching for these and they will start sending you more childbirth education classes. So these are just a good place to start for informational purposes. Breastfeeding classes, HCA actually has breastfeeding classes on the website that you can sign up for, the same place where it says take a tour. Every new parent should know CPR. Here's a link to the Red Cross. So even if you learned it for adults before, it is great to have a refresher for infant CPR before your little one or little ones get here. And if you're already seeing a chiropractor, good for you. Just be sure that he, she, or they are Webster certified. And that is a special certification that accounts for how your body changes during pregnancy. All right. Who's planning on working with a doula? Give me a heart or a thumbs up if you already have your doula. It like never ceases to amaze me how prepared y'all are in your first trimester. All right, doulas are there, and so some of you are like, "Well, what's a doula?" I have an office team, I have a hospital team, I have doctors, nurses, midwives. Who are these people? Doulas are there for emotional and physical support before, during, and after pregnancy. So they are not there to deliver your baby. They're not there. They are there to help you with breathing techniques, position changes, relaxation strategies during labor, and getting your baby in a good position so that they will come out. They're not giving you medical advice. They're helping you process your feelings about the medical advice from your team. If you have a doula who told you that you should come here, there is a reason that doulas like to come here. It's because they know they don't have to argue with us about us trying to create medical problems where they don't exist. They know that we like doulas because we like for them to spend their time physically supporting their clients. Ask the office team who our recommendations are for doulas, because there are people who we have worked with, gosh, literally for over a decade and support our moms beautifully. Acupuncture and pregnancy massage are things. Oh, and the question I have is, do you have a doula list by chance? We don't have a list. Like they're just people and names who we know. And if you come in with a, hey, I've been looking at this lady, I can tell you whether or not I know her. Like I can't say I don't like this person, but I can tell you, who I have worked with before. And the question I see is, where do you meet with the doula? That's up to the doula. So ideally, you want to meet with her early in the pregnancy, again, so you can make sure that your personalities jive. Because what you don't want is somebody who does not have the personality that goes with you when you are in labor. That is the worst. Question I have out here is, are massages safe in first trimester? The short answer is yes, comma, but the longer answer is most places won't do them in first trimester, because first trimester is when most miscarriages happen, and a lot of places won't do anything to you in first trimester because they don't want you to associate some unrelated outcome to anything that they did. Once you're ready in second trimester to have them done, some places still require a note from us. Just let us know. Naisha has a note that she can send you, and you can take it with you. Breast pumps, I showed you how to order those on the website. When you're ready, around 20 weeks is a good time to do it. If you forget the website, when you come in for your visit, we have the QR codes that are in the room that take you to that same website to show you how to order your breast pump. For those in your family who need to use the family medical leave in order to have bonding time with the baby, we use a third-party vendor, Leave Guru. If you've ever tried to get FMLA forms filled out before, sometimes like a 2-week turnaround. A lot of these are done in less than 24 hours, if not 10 minutes, as long as you put all your correct information in. That's the most common reason for delay, from what I've heard from them. And Kylie will help you get set up with them. Postpartum care, because you will deliver. We have a 100% delivery rate. For those who had any issues with their blood pressure during pregnancy, first-time moms, listen up. You are at risk for gestational hypertension just because you're a first-time mom, because the placenta gives off hormones in a first-time mom in sort of this like autoimmune protective sort of thing, where it says, I don't recognize this DNA anymore. Like one day it just wakes up and chooses violence. And it's like, I need to get more blood to the baby. So I'm going to make your blood vessels really, really tight and constrict. So if your blood pressure starts going up at the end of pregnancy, people use it, I never had any issues with my blood pressure before. I know, girl, you've never been 37 weeks pregnant before with the placenta that's trying its hardest to save your baby by getting rid of you. So if you have any issues with blood pressure, I mean, we're talking like 1 in 8 first-time moms are going to experience this. We see you sooner because the most common time for serious blood pressure issues is actually in the first 14 days after you deliver. So we bring you back to the office within 5 days after you deliver, when you go home from the hospital, so we can make sure that we're not moving into preeclampsia. And preeclampsia is not just prenatal, it's postpartum as well. If you had a belly birth, you're coming back in 2 weeks for us to take a look. And remember, the care for post belly birth is also on the website too. Mental health screening, postpartum depression, postpartum rage, postpartum anxiety, those are all things. Depression gets the most press these days, but baby blues are that normal hormonal kind of shift right after baby. You're a little tearful and that sort of thing. That usually resolves in the first 2 weeks after delivery. If it's persisting past that, we are bringing you in, we're doing a mental health screen, and we're seeing whether we are showing signs that we may need a referral to something like the motherhood space, which is a resource here in Jacksonville. It's fantastic. They have group and individual counseling. They have light therapy, yoga therapy, exercise therapy, all paid for by a grant or your insurance. And they have childcare for babies 6 weeks to 12 years old there. So no reason that no barriers, or they try to eliminate many barriers to care. Postpartum doulas are these angel people who live in Jacksonville and will come take the night feeding so you can sleep. Sleep is so important. Postpartum doulas, again, doulas are there for emotional support. When do you need more emotional support than when you have this little person who doesn't speak the language yelling at you at all hours of the night? Pelvic floor therapy. This is standard in Europe, and we're working on it here. I have a nurse who comes here 3 times a week, Tracy. Tracy's here on Tuesdays, Wednesdays, and Thursdays, putting one pelvis back together at a time. So things that we don't, really hear about. What if you have a tear? What if just stretching was really uncomfortable for you and you didn't tear? Leaking urine, uncomfortable intercourse afterward. Pelvic floor therapy addresses all of those things, and again, is covered by your insurance. So these are frequently asked questions. You can sleep on your left side, your right side, or your back. If sleeping on your back makes you dizzy, get one of those wedge pillows off of Amazon, slide it under your hip. You can help paint the nursery. Just be sure it's a well-ventilated space. You can take probiotics, prebiotics, postbiotics, all the biotics that they came up with to get your money. Hair dye is fine, including your eyebrows, if you are so inclined. You can do gel nails. Just be sure if you're in a salon with like fumes, you may want to wear a mask so you don't get dizzy and pass out. Car travel, like y'all are fine over the summer. Oh, y'all gonna be delivering around or going through the holidays. So that's fine. Up to 37 weeks. It's not unsafe to travel after 37 weeks. Remember, you're full term at 37 weeks and your baby doesn't have a calendar. So you're going to, whatever far corner of Alabama where full circle will not be, and your baby decides it's my birthday. So up to 37 weeks, just be sure you're getting out and stretching every couple of hours. Flying is okay for singletons up to 36 weeks, for twins up to 32 weeks, assuming no other issues with the pregnancy. Just please be sure you are wearing your compression hose. You are drinking lots of water on that plane. Like, you should be in the aisle seat, because the number of times you get up and walk to the bathroom should be aggravating to everybody around you. And then for skincare, you can use your benzoyl peroxide, salicylic acid, whatever, just nothing that has retinol in it. A retinol substitute is bakuchiol, Bakuchiol. It's a vitamin A derivative that is not harmful to the fetus. So because summer is actually ending, I guess. No roller coasters, no water slides, no jet skis. All right, and then last thing before we get off is our upper respiratory infection update, which is current as of right now. So if you're planning to get boosters, ACOG strongly recommends versus supporting either way, because of the time, in the 3rd trimester, you have time to build your antibodies to give to your baby in breastfeeding. If you're getting a COVID booster, specifically Moderna and Pfizer, are fine. We don't recommend Johnson & Johnson because of its independent risk of blood clots. So if you're more than 6 months past your Moderna or Pfizer and want to protect your baby from COVID, then that's the time to do that. If you're more than 2 months past a Johnson & Johnson injection, get a Moderna or Pfizer, again, because blood clots, and mixing matching is fine. No optimal time for these against the flu vaccines, RSV, or Tdap, which are also all fine in pregnancy. If you do get COVID, there are no recommendations for ivermectin, azithromycin, or Plaquenil, so we do not prescribe these. But what we recommend is, one, that you don't come in here with anything. Don't come in here with RSV. Don't come in here with the flu. Don't come in here with COVID, please. We do recommend that you convert to virtual appointments, because we do still want to check on you. We want to make sure that you're okay. You don't need us to send anything in for you. You don't need to review what our recommendations are for vitamin D, zinc, vitamin C, and COVID specifically, because it has been associated with gestational hypertension, because we didn't have this many people with gestational hypertension prior to COVID. But contracting COVID does increase your risk for gestational hypertension. So we recommend a low dose aspirin to reduce your production of thromboxane. normally, one of the hormones that increases your blood pressure at the end of pregnancy. And serial growth ultrasounds, because that restricted growth can also show up. Like we could see earlier that the blood supply to baby is diminishing by baby lagging in growth. If you do get any of these, again, supportive treatment at home. You only need to go to the hospital if you're having difficulty breathing or you have a fever that you can't bring down with a normal amount of Tylenol. For those who had your last babies during COVID and it was like all masks and nobody could come in, deep breath again. Everything is back to normal. We're back to 4 visitors. So for everyone, you can have 4 visitors when you are in labor, and labor and delivery is 24-hour visitation. Once you have the baby and you move over to postpartum, then the visitation goes back to the regular hospital hours. And we're not masking in the rooms or masking in the hospital anymore unless you are actually positive for COVID. And even if you are, we don't separate you from your baby. We give you an N95 mask and an isolate for the baby so that they're protected from your respiratory droplets, but we still encourage breastfeeding. Question I have up here is, I had preeclampsia during my last pregnancy. Should I start taking low dose aspirin? The short answer is yes, but have you if you haven't had your history visit with me, I don't recognize your name yet, but if you at your history visit is usually when I tell you when you should start taking the aspirin. Next question is, does your doula count as a visitor? No. So 4 visitors plus your DONA certified doula. So if you have a doula in addition to the 4 people that you want in the room, she's considered part of the birth team. She's not a visitor. All right, that's the end. Great. You guys were amazing. Thank you for all those questions. They were fantastic. We are social-ish. I don't know when's the last time we posted anything, but we're going to start again. But we're on all of these things. So if you're interested in just looking back and seeing what we used to post, because it used to be really good, and we will start again. I'm looking to see if there are any other questions coming through right now, and I don't. So thank you all for joining me today. This was a fantastic. I had a great time with you all, and I'm looking forward to meeting with you if I haven't already for your history visit and for some of your prenatal visits. Thank y'all. Have a wonderful evening. Bye.